Hey guys, welcome back to the Community Cares Podcast. I'm Dave. I'm the Executive Director here at Good Shepherd's Clothes Closet.
I'm Nika. I'm Mrs. Dave.
I was going to say, Chaz, you look so different today.
I'm Chaz.
Chaplain Chaz did want to let you guys know that he is disappointed he wasn't able to make it, but he did have an emergency that had to be handled. So, Chaz, we are sending you our thoughts, our prayers, and all of everything for sure.
Since he had an emergency, I didn't pretend to be him.
Oh, yeah. You got to be nice. You got to be nice to people who have emergencies. But we definitely miss you, brother. And please be safe and make sure everything's handled the way it needs to be handled. And I know you will. That's the kind of guy he is, which is why he's the president of Good Shepherd's Clothes Closet. Do you appreciate Chaz?
Yes.
You better say nice things. He's had a rough day today.
I did say nice things.
She's notoriously mean to Chaz.
She seems like she's mean to Chaz.
Sometimes. It's playful, right? Playful banter. Nothing wrong with that.
Chaz is wonderful.
Well, we miss you, Chaz, definitely. And we are so thankful to have our guest on with Doctoroo. Please introduce yourself, Cameron.
My name is Cameron Gaylor. I'm the operations manager for Doctoroo in Reno.
Awesome. Thank you so much for being here today and sharing with our viewers what you do and all the different things happening within your organization. I think it's a pretty cool concept. Just so you guys know, too, and we say this all the time, we are not sponsored by these guests. These guests are here on their free will, a lot of times on their off time, to come and be here to represent their organizations. Thank you, man. And it's just a fun way to share all the different resources within the community. We always start, though, with our 3 upcoming events that we wanted to highlight this week. And the first one is the Holiday Lights Festival. From cozy comfort foods to tasty treats, there's something for everyone at the Holiday Lights Festival on November 29th through the 30th. Starts at 4 p.m., ends at 9 p.m. on the 29th, and the next day I think it ends around 5. So it's an early morning, ends at 5.
If you like this podcast, Dave might bring his really cute dog to meet you.
Absolutely not. I won't do that. But what was your thoughts on the event last year?
It was really cool. There was a Christmas tree lighting, and lots of people came, and it was a lot of fun.
Yeah. No, I had a lot of fun, and you helped me table at the event last year. They had some great mead. Like, it was hot. It was by Black Rabbit. That was pretty good.
That was really good.
And it was nice to stay warm because it was really cold last year. So we got to bundle up this year.
My dad bought frogs. I remember that.
He bought frogs?
Stuffed frogs, like little stuffed animal frogs.
Yeah, because we were both thinking, what? Frogs?
It's an odd time to be buying frogs.
That is an odd time to be buying frogs. But, yeah, definitely come down, support us, come say hi to us, and we're going to have a table sharing with people what's happening at Good Shepherd's Clothes Closet and about the resource in the community. And, yeah, come say hi. The next event, first, I want to say thank you to Brighton Dennison at Great American Craft Fair. He's the one that donated the booth to us. Thank you, Brighton. You're a great friend. You've been a great friend to Good Shepherd's Clothes Closet. And you've done that for us for all sorts of events that Great American Craft Fair has had. Not only that, you've been on the show. And so, huge shout out to Great American Craft Fair. And definitely be there by the Believe sign in downtown Reno. They do a big tree lighting and all sorts of stuff during it too. So, fun event. Next event we want to highlight is the event here at Good Shepherd's Clothes Closet, which is our open house fundraiser. And on that day, we're doing a live podcast episode here at Good Shepherd within the store. And that will be our open house fundraiser on December 3rd, which is Giving Tuesday, and we'll have raffles, we'll have drinks, wine, all sorts of things is included in your $5 ticket. It's just a way to help support Good Shepherd and help us to have a great beginning January coming up. As you guys know, we are a nonprofit. We only exist because people donate financially. Though honestly, our 620 people, the people that donate $20 a month, are the backbone of our organization. Without individuals, this place does not exist. Did you have anything to add, Nika?
I'll be there helping.
What will you be doing?
You said I could serve beverages.
You're going to sling drinks?
Yeah.
Wow, that's pretty cool.
Yeah, shaken, not stirred.
Not those kinds.
Just put me somewhere and I'll do something.
I don't recall getting an invite to this event.
It's public. You can come on down. We'd love to have you. It's fun. Snacks, drinks are going to be included. So in that $5 ticket. So it's definitely worth it. $5, you're not going to find snacks or drinks for anything. So thank you so much for Smart and Final for donating the $400 grant for the event. Because you guys were able to have that event and make it a fun time. So thank you guys. And our third event we are highlighting is the 2024 Sparks Hometown Christmas Parade. It will be celebrating 37 years of tradition on Saturday, December 7th. This year's theme is a cowboy Christmas. The parade starts Saturday at 1 p.m., starting at Pyramid, moving down Victorian Avenue to Victorian Plaza. Come down and be here early to get a photo with Santa or hang out afterwards and see the 39 North Pole, which is light displays, food, entertainment, and Crafters Village. So it's going to have a lot of different fun, eventy kind of stuff there. I like the parade. The parades are always fun.
I'm actually really excited about this because I've always wanted to be in a parade, and I might get to be with the float.
You might be. I don't know. You have to talk to the executive director.
The executive director said I could not sing like Ariana Grande on a Wicked float, but
You
that's
may
okay.
not. You may not.
But I still get to be part of it, so it'll be really cool.
We are going to have music and stuff, though. Yeah, we have a whole float that was donated by a donor. So thank you for donating that if you're listening. But we got a float. We're going to have fun. We're going to be pulling with the Good Shepherd truck.
I want to be an outlaw.
I've never been in a float before for a parade.
I don't think Ariana Grande is an outlaw.
Oh, maybe. There you go.
I don't know. You don't know what she does in her private time.
Well, you know, it's a lot of fun, and we're just so thankful for the donation to be able to have that float. We only exist because of people donating and believing in our cause, and we're going to have fun with a cowboy Christmas theme float for Good Shepherd's Clothes Closet.
Yeehaw.
Are you going to wear cowboy boots?
I don't have cowboy boots. I have combat boots. Does that count?
Sure, you can wear. We'll let it pass.
It's modern day cowboy.
Yeah.
Because I don't really want to buy cowboy boots, and I would have to buy them.
You can buy me more boots. That'd be fine.
Yeah, that's what I thought. But yeah, we're gonna have fun. Be on the lookout for us. We're gonna be floating down on Victorian Avenue. So, yeah, come join us on the 7th at 1. It's gonna be a good time. Now, finally, last but not least, we're gonna dive into our community resource of the week. Cameron, thank you so much for being here.
Of course.
Thank you for sharing your resource. And we met at one of the events that we had here. I think it was the one at Good Shepherd's Clothes Closet, or maybe it was one outside.
I've seen you at a lot of events around town, so it's hard to say.
Yeah. So, and you were telling me all about Doctoroo and what you guys do, and it's a very interesting, very different as an organization what you guys are doing, and very the kind of care that comes to people. So please, why don't you give us the lowdown on what you guys are doing?
So the basic gist of it is anytime someone would think about going to the urgent care or taking family members to the urgent care, they can just call us. We come to their home or wherever they're located, and we can treat whatever an urgent care can treat there inside their home. And I mean, that includes everything from IV fluids if they need antibiotics for infections. We treat we treat breathing treatments. We do EKGs. We can splint broken bones. We can get mobile X-rays to the house. And we treat everybody 6 months old to end of life. So
Wow.
It benefits everyone from the mom with 4 kids that one kid's sick and she doesn't have to package up the other 3 to get them to get the one sick one to the urgent care. But it also helps the elderly person that isn't able to drive anymore and has a hard time finding a ride, and we're a resource for them to call to help keep them out of the hospital, because a lot of the times, not a lot of the times, but it can be that when they go into a hospital, they can contract something that they didn't have before they went in.
Yeah.
So it kind of puts them at a risk going into the hospital when they don't need to be there.
Yeah, I think that's so cool because
Yeah.
it's like you guys are mobile urgent care. Like, what? That's great. Very future minded, honestly, with so much convenience of like, Walmart Plus and Uber Eats and all that kind of stuff, right?
Yeah.
And so you guys are taking urgent care and bringing it to people. But I think I already know the answer, but I'm going to ask you for our audience and for Nika. Cost differences. What are the cost differences?
So it's the same exact cost as if they walked into an urgent care, but they get to relax at home, and it covers everything that we do in the visit. The price doesn't fluctuate for the patients. It doesn't fluctuate for the insurances. It just makes it so it's an overall really good experience for the patients. We take all of the Medicaids and all of the Medicares and most other commercials too, but I like to really focus on the Medicaids and the Medicares because one, I grew up in that population, is just what the bracket of life I grew up in was. I had Medicaid, and finding good health care was really hard.
Yeah.
I mean, it's really hard for everybody nowadays.
Absolutely.
But it's a population that I really wanted to help, so I put a lot of focus into reaching that group of the community.
Yeah, Rob McLaughlin says, yeah, buddy, probably about the Sparks Christmas Parade, and what an awesome service. Definitely an awesome service, and I love the fact that you're serving that population.
Mm-hmm.
I mean, that's great, and I know for me, so I think the question I want to ask then is, what's like the turnover like? So say I call Doctoroo, how long does it normally take for someone from Doctoroo to come and help?
Yeah, so typically it's always same day visits unless you're calling like super late at night when we're getting ready to close. But if you call anytime in the morning, afternoon, early evening, should be able to be seen same day. And then if not, you wouldn't be seen in an urgent care either at that time. So
yeah, exactly.
We would schedule you for first thing in the morning.
Yeah, see, that's crazy thing because we've done urgent care for things, right? And it takes, sometimes we have to schedule it out for the next day, even if it's not late. Like, we can't just walk in and do urgent care. We have to schedule a visit, normally for us at least, when we've done it. So I think that's amazing that you're able to basically bring those services not only quickly, but to people's homes. Like, that's important. That really matters.
Yeah, and a key part of it is like one, patient safety and just overall like outcome of them after being sick. But we do take safety into account. So I talked about keeping people out of the hospital if they didn't need to go. So when they call and make an appointment, then a provider calls them before they show up for the visit to triage the patient. And then if they feel that the patient is too unstable or what their symptoms they're complaining are too complex for what we can do, then we would advise them to go to the ER. Now, if they refuse, we still go and we do as much for them as we can.
Yeah.
So we're still trying to help as much as we can, but we do know that there's certain things that need to go to the hospital. So in that case, we send them to the hospital, but in a large majority of the cases, we keep people out of the hospital and they get to stay home, and the kids get stickers and they get to play with all the medical equipment. And our teams love going into patients' homes and just seeing that side of a patient's life, because when you're seeing them in the ER or physical urgent care, you don't see that part of their life. You don't see that the elderly person's house is filled with old rugs that need to be get rid of because that's a falling hazard, so
Yeah.
we treat the overall patient. We have a list of resources that I've gathered doing all the events where I see you, and then if my teams feel that a patient would benefit from any of those services, they share it with them right there at their visit. So
That's awesome.
Yeah.
Very cool. And and you're at a lot of those resource fairs that I'm at, so you know a lot of the same resources I do.
Yeah. Well, I would say probably all of them.
Yeah, absolutely. And I think that's so cool. And Rob McLaughlin says, actually old school house calls, nice. Which is, it is kind of old school. I know there's some situations where Nick and I have been in where it would have been really nice to know about Doctoroo, honestly.
Yeah, and it's not even like there's no requirements. You don't need a subscription. You don't need to be so sick that you can't drive or not have a car or anything. Anybody can use us. You just call the phone number, schedule an appointment, and then a team shows up and takes care of you.
Do you know the phone number off the top of your head?
It's 888-888-9930.
Whoa, that's easy.
Mm-hmm.
Do you have any questions?
I don't have questions, but I think that's really amazing. I once, I was looking at a fish and I fell and I sprained my ankle really bad. Like it was black. Both sides of my foot were black. And I had to drive all the way out to Carson to go to urgent care because that's just the only place I could get an appointment before work.
Mm-hmm.
So it would have been nice to know about that and just take the day off and stay home.
Yeah, and we even treat people in their offices while they're at work.
Whoa.
See, that would have been awesome.
we treat kids at daycare. We treat people at like our place and different facilities in town. And the other day, a team treated someone outside of their semi truck at one of the truck stops over off of McCarran. So we treat people in weird conditions, and that everybody seems to really appreciate it, and it just makes the team like doing it even more.
Well, that's one of the things we talk about a lot is meeting people where they're at, right? Mm-hmm. And you guys are actually meeting people where they're at. With our microcloset expansion project, that's one of our goals is to truly meet people where they're at, which is why we got the grant from Molina Healthcare is to, we purchased a truck and we're able to bring clothing to people that need it at our microcloset expansion project partners. Mm-hmm. So Eddie House is one, Bristlecone's one. And so there's different points where they can request certain shoes, certain items, and then we're able to deliver it to them normally within a week if we have them. So
that's awesome.
So it's that concept, really meeting people where they're at is such an important service, I think, for the community. And it's something that we should probably think about doing more. Now, we have another comment from Rob. It says, stickers are cool. Just to let you guys know, if you're a listener, if you're on Spotify or Apple Podcasts, and you're like, how do I comment? How do I get in that live show? Come on to Facebook, facebook.com. We do it live here every single Monday at 5:45 p.m. And you can comment live and we'll talk about your comments, your questions, and whatever else is going on. We always think that's a great way to be able to have questions and answer them for our guest and even us. If you're like, oh, Dave, Chaz, Nika, do you guys know about this resource in the community? We'd love to talk about those things and go back and forth with you through the comments. Yeah, so tell me more. Where do you know where the name Doctoroo comes from?
I do, or I hope I do.
You think you do?
No, the owners are two brothers from Australia.
Cool.
So that's where the kangaroo comes from. It's catchy. It's and it's very noticeable on the side of the car. It's hard. It's very hard to miss.
Yeah, I like your branding a lot. It's
yeah.
Cool. And if you you mentioned it a little bit earlier, why you're doing what you're doing because of the Medicaid population. You said you grew up in that situation. What are some other reasons? Like what inspires you to do what you're doing?
Well, I wasn't always the operations manager. I started out as a technician when I retired from the military. So I've been doing the mobile urgent care thing for 5 years now. Yeah, 5 years. And I've been with Doctoroo 2 years. 2 years this month, actually. Yeah, so 2 years. And as a tech, I really saw like the benefit to people being treated in their home because, I mean, I've seen it in some hospitals, not all, just being around the country and in different parts of the world, is that some populations don't get treated with respect in the hospitals. And, you know, just having the teams go into their home and treat them there, I've always seen that they feel like they're being respected a lot more. Their needs are being heard more. We get to spend more time with them, and the outcomes have been fantastic. The patients recovering from, we've kept people out of the hospital with pneumonia that was in both sides of their lungs, and they never had to go to the hospital.
Whoa. That's crazy.
Yeah. So the care that they get in home, and then just how much my team enjoys their job, really makes me want to keep like spreading the word and making sure everybody knows about us, because I truly believe in the model, and so does my team. So once people use us, they never don't use us.
Yeah.
So use us.
Well, that's how you stay open, right?
Yeah.
No, I think it's a really cool model. I'll be telling people about it for sure. And it's great that you guys take Medicaid and Medicare. I think that's really important. And that it's not cost prohibitive. Like, it's the same as if you had to go to urgent care. That's huge. So you don't have to share it, but if you want to, you can. We were talking a little bit before the camera came on about an experience you had recently that was scary for you.
Oh, I was in the hospital for 10 days and definitely didn't almost make it, but we're here now, and I'm starting to get back out into the community more because I was just trying to take care of myself for a while there. And
I mean, an experience like that probably inspires you to keep doing what you're doing, and makes you want to love the people that you love around you, right?
Yeah, it definitely put a lot of things in perspective.
Yeah, those near death experiences can definitely inspire us and move those needles forward for sure. So
yeah, and it also just kind of showed me I was very lucky because I was in the hospital for that long, and the owners of Doctoroo like truly took care of me.
Whoa.
And made sure I got healthy before I came back to work, and like supported me the whole way. And they've been like that the whole time, and they're supportive of all these community initiatives I'm working on to expand wellness evaluations and sports physicals around town. And I'm definitely happy with how everything turned out. I went through a rough spot, but saw a lot more better things than I did the bad spot that happened.
So, weird question, and the answer is probably no, and that's okay if it is. I haven't been seen by a doctor in a long time. Do you guys do like general checkups or things like that?
It's not something we normally do, no.
So I've got to go. I got to buck up and go find a doctor.
Yeah, you got to get a primary. Because you'll hear my team tell you to get a primary doctor.
Yeah, I bet. All right, fine. Yeah, I'm really bad at seeing the doctor.
No, trust me, I was too until about a month ago.
Oh, boy.
I used to have to call our dentist and tell them if he calls to cancel his appointment, don't listen to him, because he would call and cancel conveniently the day of all the time.
I have a fear of doctors, okay? I don't like needles. I don't like doctors normally. I mean, it's not like I don't like them as people. I just don't like going to the hospital.
Well, this is what they wear. They don't wear the white coats or anything.
That's
so
true.
It's more comforting. You can have Star Wars playing in the background in the living room.
There we go. That's a good idea.
But again, you still need to get a primary.
We'll just wait till you're like kind of sick, and you can be like, can you check everything else while you're here?
Can you check everything else, please? No, I think that's great. I love the service you guys are doing, and we'll probably utilize it at some point.
6 months old.
I know, exactly. It's
Oh, yeah.
there may be some times where he gets sick. Hey, where you at, Cameron?
We see a ton of ear infections.
Yeah, I'm sure.
That happens a lot with the
Yeah.
little ones.
And you know, we'd have to go to urgent care anyway. So why not have the urgent care come to us while we're taking care of this little twerp, right?
Yeah, and if it's later at night, we carry all the medication. We carry all the medication with us. So
Oh, really?
So even if your pharmacy's closed, they can get their first dose, so they can start
Wow.
feeling better before you
That's
can
really cool.
make it to the pharmacy.
Man, that's really cool. Rob thinks I need to go to the doctor, so I think he's probably right. But if you guys are listening to this and you had any value from this video at all, we're not quite done. But I did want to just plug that you can find us on Spotify, Apple Podcasts, and everywhere else you get your podcasts. All you have to do is type in Community Cares Podcast, and we pop right up. We're definitely all about the community and community support. And just please, if you have comments, ideas, anything, shoot them our way. My email is dave@gsccreno.org, and I'm the executive director. So just let us know what your thoughts are. And further than that as well, we also really care about the community, and if you have events or other things you want to share with us, please share that with us as well. We're always in need of volunteers. We're always in need of financial donations. We're always in need of clothing donations. That's how we exist. That's how we keep moving the needle forwards here at Good Shepherd. Visit getclothes.org for more information. Cameron, what other thoughts do you have about Doctoroo and why people should use that service over regular urgent care?
For one, I just know the team, and growing up here and being in healthcare, the healthcare community is super tight knit in Reno Sparks. Like, everybody knows everybody, and the team I have is like the best of the best. Wow. So they've followed me through a couple jobs, so we're all really close. So, and all of them have families that we all take care of and things like that. So just know that when they're coming to your house to take care of your family, they're giving the same care that as if it was their own family.
Wow.
Yeah.
That's pretty cool. It sounds like you really care about what's happening at Doctoroo, and the owners care about you, which is really important. Mm-hmm. So, and that kind of organizational leadership definitely bleeds into that customer service, right? It really does. So that because you're taking care of from the top all the way down, it just goes to the customer or patient at the end, right?
Yep.
So it really matters. So thank you for doing what you do.
Well, thank you for having and also doing what you do, because you're one of the resources that we give out the most. So
wow,
yeah,
of course, yeah, you're welcome. And we love doing what we do, and we love being able to work with community partners like yourself and get what you guys do out there. Because I was really interested, actually, when I heard about what you guys did, mm-hmm. just because it's something I've never heard of, which is crazy because it is something that it used to be around.
Looking back, I wish we could have had that. My little brother is severely autistic, and so taking him, like, nonverbal, mm-hmm. And taking him into waiting rooms was always a nightmare.
Yeah,
and so it would have been so cool to just let him be in the comfort of his own space. And
yeah, and that is something that I do like to bring up, so thank you. But with that, we do see a lot of nonverbal patients for that specific reason. Mm. They're a lot more comfortable at home. Mm-hmm. They don't, I wouldn't say get violent, but I mean, like they're not comfortable in those spaces.
No,
so
he
they
loves
take
to
it,
get up
so
and wander around, and like he'll like try to wander into doctor's offices and stuff. And
no, yeah, we treat a lot of them at home, and the parents are like, I don't think I've ever seen him get his vitals taken like that. So it's pretty cool to see them be so accepting of us because we're there in their space.
Yeah.
Mm-hmm. And a lot more comfortable.
Well, yeah, like I said, the doctor's office is scary. Right? I mean, all those needles and everything. But definitely having it in their own space, in our own space, is definitely something I really like. I think that's a really cool thing. So if people want to find out more about Doctoroo, how can they find you?
Doctoroo.com. We have an app. And then
You guys have an app?
Yeah, we have an app.
That's pretty cool.
It's kind of like Uber, where like when the team puts that they're heading towards the patient, once they're within 10 minutes, they can see the team moving on the map. Cool. So they can have their animals put away and like just be ready for the visit. So yeah, we do have an app.
Oh, that's cool. I did not realize that.
Yeah,
that's interesting.
So you can request appointments through the app, through the website, and then the phone number, the 888-888-9930.
That's great. Yeah, no, I think that's a great service, and I'm glad you're doing it for the community. And just hearing your inspiration behind it is pretty cool. So thank you so much, Cameron.
Of course, thank you.
Hey, if you guys enjoyed this, please like, share, subscribe, and do all the things that you do on the internet. We really appreciate everyone. Did you have any final thoughts, Nika?
No.
You talk a lot less than Chaz.
I'm sorry. I'll do the heart thing like he does. Can I make the heart?
I don't
Does
know.
It work?
I can never make it work.
It doesn't work for me.
I've
I'm
never
not
made it
special.
work. Chaz is the only one
What
that can
else
do
does
that.
he do?
Thumbs up, 2 thumbs up.
Nope. Oh, I did it.
Oh, we
I
have
did it.
fireworks. Our poor listeners are like, what's going on? All right. Well, thank you guys so much. If you want to find out more about Good Shepherd's Clothes Closet, please visit getclothes.org. We are a small local nonprofit that exists because of people like you. So thank you. We help over 700 people a month, no matter what. And we're asking you to come alongside and help one. All right, guys. Thank you so much. We'll see you next week. Bye.